Ah, buongiorno. I believe you're here for a story. Well, it's the story of a man.
Here's a story.
Thanks, fellas. No, this is not a story about the Brady Bunch, okay? This is the story of a man named Trento. And the story starts where else but in Italy. Dr. Trento was a young medical student with big ideas, and he shared these ideas with his American girlfriend.
It's a moment that's just frozen in my heart. It was one of those special moments. We were in Assisi, beautiful medieval town in Umbria, in the middle of Italy. And I remember him talking. He was sitting across the table from me, and just behind him, the full moon was rising. And he was talking about what he wanted to achieve in his life. And he was talking about wanting to help people and maybe wanting to go and learn a technique somewhere that wasn't done in Italy so that he could bring something to his own country as far as helping with medicine and helping people. And as he was talking, I remember thinking, I hope this man finds the right wife. I hope he's going to find someone who understands how pure his heart is in wanting to help people.
Of course, Robin did not know that that right wife would be her. They were young, she was leaving Italy, but as with any good Italian drama, love triumphed. They were married. Alfredo finished his training as a heart surgeon here in the United States. And then the Trentos got an offer they could not refuse.
We heard that Cedars-Sinai in Los Angeles was hoping to start a heart transplant program.
Dr. Trento was the man for the job. He was recruited as director of the heart transplant program and director of pediatric cardiac surgery.
I moved to Cedars-Sinai in October of '88, and in December, we did the first heart transplant. She was 64-year-old, I believe. And this patient is still alive, 20 years later.
550 patients later, Cedars-Sinai is home to a world-renowned heart transplant program. In the mid-90s, Dr. Trento's team performed an unprecedented number of successful consecutive heart transplants. A record number, 100 patients in a row, were wheeled out of the hospital with new beating hearts.
But you bring your patients home with you all the time. They are always in the back of your mind. When there is a patient in the hospital that has a problem, you leave everything you do. Doesn't matter what you are doing, and you go.
Well, as a recipient of that attentive care, I can say that while I didn't adore having heart surgery, I did adore Dr. Trento. I also understand that Dr. Trento is a fabulous Italian chef. But, you know, I'd rather he use his skills for surgery rather than pursuing a spot on Top Chef. But I'm so thrilled to have my leaky heart valve performing beautifully, and I owe my thanks to that brilliant, brilliant surgeon. Dr. Trento is an internationally respected researcher. He was the first in the U.S. to adopt a technique that is especially useful in heart transplantation. Let me try to explain it. I'll try to sum it up for you. It's called bicaval and pulmonary venous anastomosis. I'll say that one more time. Bicaval and pulmonary venous anastomosis. Wow, I'm so proud of myself. Well, the point is Dr. Trento added his own twist to this technique, and heart transplant patients had far greater outcomes as a result. Now more than half of the medical centers in this country have adopted his method. On top of improving transplantation, Dr. Trento is working to make a better heart valve.
Well, valve repair surgery, which has been a long-standing interest of Dr. Trento's, is a type of surgery that tries to preserve the patient's own valve. In other words, not to take out the valve or replace it with a pig valve or a metal valve, but rather to work with the patient's own valve tissue to attempt to repair it so that it functions properly.
Patients who do not survive transplantation are lost to issues related to rejection. So he has launched new research on rejection that could give patients longer lives with their new hearts. In the OR, He was one of the first heart surgeons to use the Da Vinci robot, the least invasive of all surgical techniques. Dr. Trento's discoveries have impacted one place in particular, Ecuador. He partners with the group Mending Kids International.
He chose in the beginning to hook a star to us, and we greatly appreciate that. I can't even begin to tell you what a difference it made.
Every year, Dr. Trento and his team travel to Ecuador to perform life-changing heart surgery on dozens of children.
I've had the great privilege of being able to watch him when we go on these mission trips, and I've been able to watch him, and I could stand in the operating room for days and watch him operate. It's artwork. It's beautiful.
Alfredo Trento is a true healer. He is truly humble. Just ask the person who knows him best.
All I can say is that this is a person of great integrity, and even the struggles. I've just seen him handle challenges, and I'm always amazed at what a big person he is.
I bought into Cedars-Sinai as an institution, and I know that I will end my career at Cedars-Sinai. So all of a sudden I realized that I have to leave a legacy.
The trajectory of his career has been shaped by his passion for surgery and his deep devotion to saving lives. I, for one, say molto grazie, Dr. Trento. Ciao, bello.